Good afternoon and welcome to Kaftan TV. Yes, equally. Welcome to our flagship program, The Polity, transmitted every day of the week, 2 p.m. to 3:30 p.m. And this is where we talk about serious national issues that are germane to the corporate existence of this country sometimes, and then issues that challenge us as a nation. And that is where we're going today. We'll be talking about illicit drugs. Yes, that nagging challenge that has refused to go. Almost everybody is involved now. You'll be surprised the level at which the illicit trade and consumption of drugs has taken this country. Many people are hooked on drugs, and there are so many of them. You probably heard the names of some of them. Don't ask me, I really don't know, but I know that there is one they call skunk. Everybody is hooked either on tramadol, on cannabis, or even cocaine, those ones that we know that have been there for a very long time. But there are new ones now that are there, and even housewives are hooked on drugs. And then this is a multi-billion naira trade that the high and mighty are involved in it. Where is the fight today? How far have we gone in getting to the root cause of this problem? We talk about arrests, we talk about enforcement, we're going to be talking about rehabilitation, and we're going to be talking about so many other issues. So today, we shall be talking the Ndlea, yes, that national body charged with the responsibility of fighting illicit drug trade in this country. And then we have the spokesperson of that agency in the house. He is Mr. Femi, Babafemi. He is the Director of Media and Advocacy of the National Drug Law Enforcement Agency. Mr. Femi, welcome to this program.
Thank you very much. It's my pleasure being here.
Yes, he's somebody that I've been trailing for a very long time now. So it took so many of us in Kaftan TV to get into this program today. But the bulk of appreciation goes to him for having time out of his very busy schedule to be part of the program today. I am Segun Ojelade. I welcome you to the Polity this afternoon. Now, drug war. It's like it's an unending challenge in this country. And then from what we are seeing, people are asking, is this fight not too much for the Ndlea? Are you overwhelmed in the Ndlea?
No. First, this is not a challenge that is limited to Nigeria alone. It's a global challenge. The problem of drug abuse or trafficking, it's something that is of huge concern to the global community. And that is why there has been, in recent years, a coordinated global response to that. And I'll tell you that in Nigeria, indeed we're leading the effort not only in West Africa, but in Africa as a result of the things we do, both at the level of law enforcement, that is drug supply reduction, and at the level of drug demand reduction. I will tell you that Nigeria is globally recognized. The effort, the activities of the agency are definitely getting global attention, recognition, and support. So, like I did say, it's a global challenge, but then just like we have other countries responding, Nigeria is equally responding very well and achieving results. We're making progress. Definitely where we were some 5-6 years ago is not where we are today. That means whether you talk of in terms of like I said, drug supply reduction, when you look at the huge the supply reduction, that area that covers arrest, seizures, investigation, prosecution of offenders, while on the other hand is the demand reduction, which covers sensitization, awareness creation, mobilization of the citizenry of all the stakeholders, as well as prevent, which all boils down to prevention. And then you also have treatment, counseling, and then reintegration. So that's the area, that's just as it says, where we do everything, put in place strategies to cut the demand for illicit substances by the population, while on the other hand we cut access and availability, that is supply reduction.
Yeah, supply
that's
reduction.
where we cut access and availability of these illicit substances. And I can tell you, by the time we get to the point where I'll start sharing with you figures, then you agree with me that indeed there have been quite a lot of indeed when the world, when we share information with them, when we share statistics, or in fact virtually everybody in the world, that is the global power, the global powerhouses, they follow, they keep track of what we're doing, and then they indeed appreciate what we're doing, because we're not only protecting, securing our country, we're also helping them to protect their own borders, because for every gram we seize here, we're helping them by disallowing that
to get
into their own jurisdiction. So which will always pose a challenge to them, adding to the burden they are struggling with. So that's why I said that indeed we have global recognition and support for what we're doing.
Okay. I told you that you are the one that will supply the ammunition with which I will prosecute.
No, just go ahead, I'm here for
you've said so many things that we need to take a look at in the course of this program.
That's fine.
I remember years back, I was younger than this. I think it was in 1988 thereabouts. Somebody was very close to us in the little shop I was managing with my sister at that time. And he said, this young man, I just finished school, he said, you this young man, you're looking for a job, I could get you a job. I said, I was so excited. Even my sister was so excited. I said, okay, give me an address, a hotel. I said I should come and meet him there on a Saturday, very early Saturday morning. I dressed up and I went there. But as I was about entering the hotel premises, I think my mind, the spirit just told me that, what am I doing here? This man that has invited me, I don't even know his name. And this hotel is look dingy, one kind. What am I going there? So I turned back. It was later I realized that that is the cartel. That is a member of the cartel. Those people, the big time drug dealers, that use hapless individual like I was at that time. People say those are the people, those hapless, small fry that Ndlea arrests. While the big ones are out there, still recruiting innocent small boys. Yeah, at times you get a 90-year-old that you say he has a hemp farm. 90-year-old or a driver just loaded with hemp and going, and then you have made seizures. Where are those that are funding this list?
Very good question. Now I'll disabuse your mind. This with facts, figures, and instances. Now I'll tell you that in the last couple of, let's say, just let me refer to when the period of the birth of the new Ndlea, that's under Brigadier General Mohammed Babafemi, retired. I'll tell you, within the space of the short time he had spent in the agency, we've made about 70,000 arrests.
Wow.
70,000. I'm not talking of 700, 7,000. 70,000 arrests. And that 70,000 arrests had given us almost, seizure of more than 11.5 million kilograms of assorted illicit substances. Now, of that, you see, over the years, people have been, I'm sure this question came from the background of what had been over the years when only the mules, the traffickers, are being arrested. But I can tell you that with the new Ndlea, for every arrest that is made, the agency doesn't stop there. That's for the arrest, for every arrest of a trafficker or a mule that is made, the Ndlea, the new Ndlea doesn't stop there. We go all the way, just as we are talking now. I'm telling you, for every day, the Ndlea of today is busy tracking every cartel responsible for every trafficker that is arrested. That is, for any trafficker, for any of those people. That's what you know. We don't rest there. There are some people, for years, for months, we go after them, because these are layers. Even the people you arrest, they don't even know who is the actual owner. And so it takes a lot of professionalism. It takes a lot of resources. It takes a lot of deployment of technological tools, and take a lot of intelligence gathering, surveillance, and all of those combined together to be able to get to the last man. I'm telling you, we have dismantled hundreds of cartels. I'm sure. I don't want to be mentioning names, but then every time we have, for instance, recently we did one where we arrested a shipment going to Australia. That shipment was worth 5.3 billion naira. That's in foreign currency. That's street value of that. Where it was going to Australia, it was worth 5.3 million Australian dollars, which when converted there, more than 5.3 billion naira. And the only thing we arrested, we seized, was the shipment itself. And then we started working on it. It took a space of 2 weeks to be able to unravel those behind it, and we're able to get them. Yeah, so we're able to get them. Not only getting them, we just from one person to the other, without them knowing. Do you understand? Within a space of 2 weeks. It's something that it's just put it on your DC to come out. We just in Lagos there, we arrested one in Lekki. We arrested the other one, and we're able to get the house where they normally handle all the packaging of these illicit substances. And these are people that have been these are people with mansions. Yes.
I was about asking you that, although you may not want to mention names.
Yeah, because
but who are those behind this thing? Who are they in terms of, are they politicians? Are they businessmen? Are they even in the military? Are they who are they? It doesn't exclude any class. We have arrested those in politics. We have arrested law enforcement. At the moment there is a very senior security chief that is still behind bars as we speak. That was a very popular case, which you know. And many more like that. And apart from that, business people. But predominantly, if you ask me, I'll tell you that those in business, because these are actually people that have things in place that ordinary people out there will believe, okay, these are genuine business people, but beneath there are other things. And that's exactly what we are unraveling, and we're going after them. And the way we handle this, we don't just make seizures. You see, we're inflicting serious and heavy losses on them, damages on them. But then beyond that, by seizing those, because they invest a lot on those things, by seizing them, we're inflicting a lot of running them out of business.
Yes, but beyond that, we also know that even if you arrest them, send them to jail, they don't mind. They can cool off for 5 years, 10 years, as long as their bank accounts and their assets are intact. So one of the things we have also done to strengthen our deterrence regime is first seize those consignments, arrest them, prosecute them, send them to jail, then go after all their assets. Because the incentive, the only thing they are desperate, they are doing everything to do all of these things is because of the money they generate, because of the proceeds, because of the money they make. They want to live large, they want to buy houses everywhere, they want to ride big cars and all of those things, live large. So we go after all of those things and deny them the benefits of the process of crime. So meaning that we are gradually crippling them. It's not a 100-meter race. It's a long race, because even the big countries, I'm sure if you follow development in America, you see every day with all they are doing, you see the drug thing is like a monster. You cut off one head, then two grows. That's the way the drug thing globally. So it's not as if yes, we are doing well now, but it's not as if that will bring everything to a halt suddenly. No. You still have to be seen. For instance, in the last 24 hours, I'm telling you, we've made huge, I've counted, because we get reports of, like, within 3 hours of any arrest, we get reports at the headquarters of how things are going, blah blah blah. And I'll be following trends across our various formations and commands. And within the last 24 hours, I can tell you there have been 3 major heavy arrests and seizures, and these things are still ongoing. They are still unraveling. So indeed, we don't just go after the moves. I can tell you, within the same period, within the last 56 months, we've had more than 100 barons netted. 56 months? Yes, we've had more than 100 barons netted. And these are things that can be fact-checked. Okay, now, before now, in fact, when the drug trade started in Nigeria, they say, we are a transit nation. Yes, meaning that we are the ones supplying, but now, we are a huge consumer nation of drugs, and like we said earlier, almost all the strata of society is in drugs, to the extent that they are even saying that before a politician contests an election, go and check his system whether he is on drugs. It's so bad. And then again, like I said earlier, women and even up to the primary school level, they are playing with dangerous drugs. How did we get there? Yeah, quite. I'll tell you that you see, the country never really appreciated the enormity of this problem until 2018, when the report of the National Drug Use Survey conducted in the country by the National Bureau of Statistics, along with other stakeholders, supported by the United Nations Office on Drugs and Crime, UNODC, and funded by the European Union. Until that report was published in 2018, that actually gave the country the grim picture of what the drug situation in Nigeria was. And that's still what we are, even though we are there are ongoing efforts by the Ndlea along with other stakeholders to conduct another one to reassess the situation, because there are quite a lot of dynamics and quite a lot of things have taken place. But then we need to reassess where we are and then map out how to move forward. So that report showed that indeed we have 14.3 million Nigerians aged between 15 and 64 who have been abusing illicit substances, and that is outside of alcohol and tobacco. And out of this, because I know this question will get to it, so let me answer it ahead. Out of these 14.3 million Nigerians, which in actual sense represents gives us a prevalence rate of 14.4%, which is almost 3 times of the global average of 5.6%.
Wow.
So that shows indeed when really a big mess. But then you, like I was saying, because I know this question will come up, out of this 14.3 million, 10.6 million of them abuse the most commonly abused illicit substance, that is cannabis. So
cannabis sativa.
Yes, I mean there are different strains, like you were trying to describe earlier. There is the sativa, which is the locally grown one.
Yes,
that's the one we call weed, marijuana, or what have you. Then there is also the ones that are imported called loud. Now there is Canadian loud. There is another loud that comes from the US. There is another loud that comes from Ghana here. And then you have the Oga Patapata of them all, which is synthetic. That is Colos, the one that is Colorado, which on the street is also called Colos. So that's a very dangerous one. So that gave us a very grim picture of what the drug situation in Nigeria, that's report. And then, but fortunately, the Nigerian government didn't go to sleep over that. That created some reawakening within the system, and that necessitated the setting up or the establishment of a presidential committee called the Presidential Advisory Committee for the Elimination of Drug Abuse, PASIDA then. And coincidentally, the person that was appointed to chair that committee is the current chairmanship executive of Ndlea, that's General Marwa. He was the one, and it was following that assignment, wherein they made recommendations on what the things to do and what have you, that obviously led to his appointment as the chairmanship executive of Ndlea. And since then, it's never been a dull moment, that I can tell you, because like you rightly said, over time, just as it is again anywhere in the world, there is always, when you talk of transit, it's just like the person, okay, let me create this analogy. When you cook, let's say for instance you are cooking to serve others, you want to test. Do you understand? So that's exactly what happens when you describe the community as a transit hub, because out of the bulk that is being taken, that's the transit hub. It's a point where these things are passing through and being distributed to other places. Some of these things also, they are not manufactured or produced in Nigeria. They come from other places, Asia, the Americas or Latin America, to us, and then through us circulate to Europe, just to it's a disguise.
Yes,
because if they are coming, because those places those destinations are already flagged as source countries. Now, to disguise the origin or hide that something is coming, then they take them to another place, which made Nigeria a transit route. And then from here back to even, for instance, America or Europe. But then out of that you see little drops. Yeah. So then, and gradually the things that were just passing by, we started to play with it, consume, and then. But then we're glad that I'll tell you that indeed, like I said, there have been relentless efforts to mop up these things, and not only to mop them up, but we work with our global partners. When I'm talking of global partners, the best in the world. Talking of the International Narcotics and Law Enforcement in the US, INL. We work with Drug Enforcement Administration in the US, that's the USDA. When you come to Europe, we work with Home Office International Operations in the UK, Border Force in the UK, National Crime Agency in the UK, we work with German police, we work with French police,
Canada.
we work with all of them, we work with Brazilian police, we work with General Directorate of Narcotics Control in Saudi Arabia, we work with NCB, that's Narcotics Control Bureau in India. So all over the world, all of these places, we work with them because, like I said, there is a coordinated global effort, because this is not what any nation can respond to in isolation. So you have to work with, and that's why we're getting results, because we're building synergy, network, and creating partnership with all of these people, so that as a result of that, we share intelligence, they give us information, they support us in diverse ways, logistics, training, capacity building, and a lot of other ways. And we even conduct joint operations in a lot of instances, and that's why we are always ahead, because when you see the kind of the way these people conceal drugs, you wonder how did they, I mean, I've read a lot of comments online where people say, no, nobody can tell, nobody can tell me otherwise, that Ndlea uses juju. Sometimes they say yes, sometimes they say
it's true, you guys use juju.
No. So I have seen all of those things that people say we use juju and all of those things, but I can tell you that indeed this is a result of good leadership. I'll tell you that, good leadership, very proactive, committed leadership, and professional workforce with backed by intelligence. I'll tell you, the new Ndlea, all our operations are intelligence led. We don't just move. When we move, know that we have reasons to move. And when you talk of intelligence, we're also talking of deployment of modern technological tools. Okay. I can tell you that the Ndlea of today has those capacities.
Okay. We've had stories that the porous nature of the Nigerian border. So even the customs are complaining. The soldiers, I mean the military that are prosecuting the war against terror, they are equally complaining because of the vast nature of the Nigerian borders. Yes. Routes that are now mapped, that
ungoverned spaces.
Ungoverned spaces. Now, where are your men in terms of coverage of these vast? Because I see them on the road pursuing, not pursue now, delaying hapless travelers. There are occasions that they stopped my vehicle, I mean the bus in which I'm traveling, and before you know it, they start freezing our bags and all.
They are very necessary, I'll tell you that. Very necessary. Sometimes definitely we are empowered by law to do all of those, stop and search, checkpoints, all of those things, because we have seen as a result of that, we have made seizures in the most unexpected places. Sometimes we make recovery from tires, some from engine, some from what we call false compartments. That is, they create different compartment. The compartment different from what was manufactured with the vehicle. So just to conceal and hide these things. So all of those things we have made on those through those, and that's why we encourage the people that please bear with us. I mean, it's also in their interest. It's for their safety, because if we don't make those seizures, just a little 5-10 minutes inconvenience could save your life, or even the life of your family members, your friends and relatives. So because if we don't do that, you never can tell that drug that is being transported through that vehicle could be consumed by somebody who will take you on your trip back, and then the person, because he's on drugs, he loses his mind and the unfortunate happens. So that's why we always encourage the people, please, the boys standing under the sun, under the rain, they are human beings. They would have also loved to be in their office waiting for report, but don't know. We have to, they're there morning, afternoon, night in the code every time. So that is in the interest of the public, that I can tell you, and quite a lot of results are coming out from such operations.
Okay, we've seen reports even by international media coming to our shores here, even our Abuja, this is our federal capital, to do reports. And they mention some areas in Abuja that are black spots. And you see those youths, you see them, that this one is hooked on something. It is the type of drug that we do not know that is hooked on. So there are black spots in Abuja where people take these illicit drugs, where they sell it. I don't
suppose they are often raided. That I can tell you. As we speak, we have information from some areas in Lugbe, and I'll tell you, we have just yesterday that we have information of some happenings there, and those information, those details were passed to our FCT command for targeting, and they've raided the place twice in the last 3 weeks. And just day before yesterday, we had update from those locations again. That so you see, these people they move. They are not in one. As you are removing a set, another set is coming there. You see, that's why we balance our operations. Demand reduction and supply reduction. We create a fair parity, so that, because you see those locations, the people coming there to come and sell drugs, is because they know that people here use drugs. They will find market for it. So which takes us back to the home front. The people coming out from those estates, from those locations, they don't drop from the sky. They are from homes. So which takes us back to the root of these problems. And I'll tell you, number one that I'll tell you is the family. When the foundation is weak, when the foundation is not strong, when there is a problem at that level, that is when you have kids, people coming out, raised from those families, pouring onto the streets, looking for drugs to buy, and when they take the drugs, the next thing is crime. So you can see the chain, the interconnectivity. So that's why in our advocacy efforts, we always emphasize that parents, guardians, you have a responsibility. Don't just fold your hands and think yours is to bring kids to the world and leave the kids in the hands of God. Yes, God oversees everything, but then you have a responsibility. So that's why we advocate intentional parenting, for parents to live, to be in the lives of their kids. Take responsibility. Intentional parenting, so that you won't produce kids that are always out there looking for drugs to consume. So when you address the demand reduction side, which is why which is the whole essence of our war against drug abuse, WADA social advocacy initiative, going to schools, going to families, communities, worship centers, workplaces, motor parks, markets, talking to people. Not doing it alone, but working with others, non-governmental organizations, civil society organizations, faith-based organizations, community-based organizations, to ramp up sensitization, to talk to people, so that everybody can know something, have the facts, have information about the dangers of substance abuse, and then you don't just keep the information, you share with the next person. And so we spread it like that. Spreading it like that, meaning that we're saving lives. Because if we don't do that, then you allow for the grooming of a community or a generation of drug users. Yes, if there is no demand, there won't be supply. So that is that. But I can tell you that indeed, just as we are sensitizing, and for our end, we are like a complete package. apart from the sensitization, for those that are already in use, because quite a lot of
we're going to touch on that. But you mentioned the issue of society.
yes,
and people will tell you that because we are ascribed every challenge that we have in the country to it is poverty. It is poverty. You know, it's because government are not doing well.
That's why shifting responsibilities.
Shifting responsibilities. But now you have mentioned the issue of the parents, the society, the church, the mosques,
yes,
and all of them. But don't you see an opening there where poverty too can contribute?
Absolutely. It's actually number one. That I'll tell you. It's number one factor, predisposing factor. Because you are here, you are at work. I'm here, I'm at work. We are both busy trying to enlighten the people, trying to sensitize the people, trying to share information. You won't have the time to start thinking about going to one junk or one bunk to go and take drugs. That won't come to your mind. So like it's the cliche, the devil finds
work for the idle hand.
Yeah. So that is one. Like the issue of poverty. Okay, let me just run through some of these factors. Poverty, that's key, because when people don't have jobs, when people are or they are even when they have jobs, they are underemployed. You know, it's one thing to have a job, it's another thing to be underemployed. Yeah. Then they start looking for. They go into a lot of. They go into anxiety. They go into a lot of. Some of them into depression, and to be able to suppress their frustration, their anxiety, or the kind of emotional torture, psychological torture, pain they are going through, so they resort to these illicit drugs. That's a fact. But we are glad, at least today, that the government of Nigeria is doing something about tangible about poverty alleviation. Whether you talk of even students who are in school with the loan, the school loan thing. Yes. And then you talk of the agricultural, the reforms in the agri sector, people. And recently we had a very good meeting with the Honorable Minister of Agriculture. That's the leadership of Ndlea. General Mara led some of us to that meeting with the minister, where there were proposals on the partnership between Ndlea, and so that some of the people we are rehabilitating can key in to some of the agricultural schemes, so that, because it's one thing for you to rehabilitate people, it's another thing for them to go back to the same condition that actually led them into the substance abuse. That's where the relapse comes in. They relapse again. So we're working with the Ministry of Agriculture, Federal Ministry of Agriculture, to see how, in the course of rehabilitating these people, before they are discharged and reintegrated, they are keyed into some of the agricultural schemes already put in place by the federal government, and the minister agreed absolutely, so that when these who are out, they have something tangible doing already. And when you are busy, you won't consider going to, looking for where to sniff something or drink something or pop pills.
Yes,
that's that. But beyond poverty, there are also other factors, like the family issue that I said. There are quite a lot of homes where, because such homes are broken, divorce, parents are no longer together, all of those issues constitute predisposing factors. And beyond that, you also see some homes where one or both parents are themselves on drugs.
Hooked on drugs.
Yes. It starts from what a lot of us overlook, that is sending the young people to go and buy cigarette for you,
Yes.
sending them to go and buy bottles of beer.
Buy beer.
A lot of parents do that. They sit down in their living room, ask their kids to go and buy bottles of beer, and then
I run those errands too.
oh, God bless you. Don't forget that our parents are our first role models.
Yes.
Whatever they see you do, if you check your home, you will probably see that one or two of your kids are interested in broadcast or my communication. Do you understand?
One is with Ndlea.
God bless you. You can see what I'm saying. I'm telling you. So we are our kids' first role models. So it's whatever they see you do.
And
that,
the ape.
yeah. So when these young ones see their parents smoking and drinking, they wait for you. And more often than not, they are still the same set of people you call, come and pack these things away.
Yes.
When they pack them away, get into the kitchen,
Whoosh.
they try to see, no matter the little remaining there, they try to taste it to see there must be something nice that my dad enjoys. So let me also try it.
Okay.
So that's exactly where it starts. That's the level of experimentation. And before you know it, that thing no longer intoxicates him. Then he needs something higher. And that is how it begins. And then it also gets to a point where what he gets from your remnant doesn't satisfy him.
Yes.
He starts looking for means to get money, and then he goes to your wardrobe when you are asleep or when you are out of the house, start breaking in, trying to see what he or she can steal to be able to live your lifestyle.
Okay.
So that's another factor.
Yes.
Then you also have some gene. Do you understand? When you have when you have families where parents
drunkards.
the likelihood is very high for their offspring. And then there are medical conditions. Medical conditions in the sense that there was somebody, we have a program that we called an advocacy YouTube-based program that we produce in my department in the Ndlea called Narcotes. Narcotes is bringing people with lived experiences, either in recovery or fully recovered, to come and share their stories so that others can learn from their mistakes, and so that can also give hope to those who are still in such situations that they can also survive it. And one of those stories being shared by one of people that we brought on that production, he did say that his own case, he was taking care of his mother who was on certain medications for an ailment, to treat an ailment. And then he discovered that anytime his mother takes that drug, she goes to sleep. And then him there taking care of the mother at a point also felt he needed this that makes my mom goes to sleep and totally oblivious of the issues that I had. So he too started experimenting with that thing and discovered that okay, this thing can also make me sleep the way my mother is sleeping.
It works.
That's how he also got hooked. So certain medical conditions, and then there are some people also, even the people who are using the drugs themselves, over time, even when they have been relieved of the condition that warranted the use of that, because of certain feelings they get from it, they stick to it against medical advice. Okay. So that's another factor. So we can go on and on.
Yes. Thank you very much, Mr. Babafemi. The program is The Polity, and we're looking at the drug war in Nigeria. My guest is still in the house, but for now we'll take a short break so that I can sip some water. We'll be right back. Thank you very much for staying tuned to Kaftan TV. The program is The Polity, and we're talking about the drug war in Nigeria. Is it right to say drug war?
That's what it is, because we're not taking it lightly.
Okay. Okay. Now, Ndlea is not taking it lightly. That's why we have the spokesperson of that agency, Mr. Femi Babafemi, in the studio to answer all your questions. He's been answering mine. But you can be part of the program by calling in. The number will be displayed on the screen as we normally do on this program. Please call in to ask him 1 or 2 questions or even to contribute to the discussion. The solution may not necessarily lie with any of us in the studio. It may be out there. So please feel free to call into this program. Thank you. Now, Mr. Babafemi, we do hear that so number of hectares of farmland have been destroyed in Ogun State, in Ondo, and all those places, especially in the southwest. We have a hemp farm, and people say that okay, this cannabis, marijuana, yes, that in some countries that this is good crop, can make money from it, but every now and then we see Ndlea setting them alight. Are we not thinking of utilizing them? They can use them for medicine, we can use them for so many things. Why are we wasting them?
All right, thank you very much. That's a very complex question, or a very complex area, and I'll explain that to you. Indeed, when I was giving you the statistics of some of the facts from the National Drug Use Survey that was published in 2018, yes, I did tell you that that survey identified 14.3 million Nigerians who had abused illicit substances the previous year, and aged 15 to 64, meaning that, I mean, you and I know that today you have people below 15 that are abusing, and you have people above 64 that are abusing. So meaning that there is still some gap there. But then that gives us a very perfect, very good picture to work with. And out of that 14.3 million, I told you that 10.6 million abuse cannabis alone. And I'll tell you that from the 11.5 million kilograms of illicit substances that we have seized so far, almost 70% of them is cannabis. That's huge.
It's huge.
That's huge. And there is no denying the fact.
So all of them grown locally?
No.
Okay.
But majority grown locally. That's not the, I mean, there is no disputing the fact that cannabis causes psychosis, has a lot of consequences for users. There's not, that's established. Meaning that don't forget that there is a nexus between the use of illicit substances and the security challenges we have in parts of the country. Yeah. So there is a very strong nexus, because no ordinary person in his or her right mind, in his or her right senses, will go out to abduct people on the highway or to abduct people from their homes. They do these things after they have abused illicit substances or after they have taken mind-altering substances, because these things alter their minds, alter their mental balance. They begin to see elephants as insects. Yeah. So that gives them the false courage to go out and do things that are inhuman, that are bestial. So if we are in that situation, and don't forget again that when you talk of care, we still have a very huge gap That's caring for people who are suffering from mental health challenges, who are suffering from drug use disorder. As we speak today, the Ndlea has 30 treatment and rehabilitation centers in our commands across the country. They are all fully occupied. We are, even by the grace of God, with the support of President Tinubu, will be adding another 7 before the end of this year, so that every state can have one. That's different from the tertiary institutions like Arrow in Abeokuta, Yaba left, that's the psychiatry, the one in Kaduna, in Zoka, in Zaria, Kaduna, the one in Maiduguri, all of those. So that's different from those major ones.
And there are private ones.
And there are I mean, we work with a number of them. So we still have, despite all of those, majority still can't access those things, and that's one of the things that led the Ndlea to set up a call center where people work, our experts work 24/7 to also provide psychosocial support services for people online. Okay. We have our call center there. We have counselors, clinical psychologists, psychotherapists, and psychiatric doctors who work 24/7 every day of the week, round the clock. They are on shifts. So what they do is, all anybody from any part of the country needs is to call our toll-free. We have a toll-free helpline there, 0800 1020 3040. The number again is 0800 1020 3040. Anybody.
Is that not too long?
No, it's a 12-digit number. It's easy. That's why I call it in a way that it's easy. 0800 10 20 30 40.
Terrific.
Yeah. So you call it from any part of the country. These are your issues. They will attend to you. Okay. They will engage with you and put you on them on what you call teletherapy.
My question.
Yes. And this has been done in a way, set up in a way that is not just for people in the cities, for people in the communities at the local levels. Why? Because we know that some of these people may not be able to speak English and Pidgin. What we have done is to ensure that the service also is
can access it
through any of the 3 major Nigerian languages outside Yoruba, Igbo.
Okay. Good afternoon. Welcome to Kaftan TV. Your name and where you're calling from? Good afternoon.
My question is that when is the Ndlea going to start their recruitment?
Okay, Mr. Babafemi has heard you. He's going to answer now. Okay, maybe you should quickly answer that before.
Yes. I'm glad. Let me tell you something, because we have discovered that because of the great work that the agency has been doing, quite a lot of our young people have been showing interest, and as of 2021, this agency was roughly around 4,000 staff strength, and courtesy of presidential support and the leadership of the current leadership of the agency, we've been able to add 10,000 after that to this now. Yes, and we still have some extra mile to go, and I'm sure we're in the process. We're looking forward to rounding that figure up very soon by the grace of God, hopefully before the end of the year.
Okay.
I can't say precisely, but I'm aware that there are processes on to be able to beef that up by the grace of God.
My question, because we have much to still cover. My question: why are we burning weeds?
Okay, yes, we were on that. I think we were on that before we deviated. Yes, like I was trying to actually create a context for you to know that this is actually not something very good for our environment. In our situation now, there might be, we may not be able to say tomorrow. There may be different strategies. Different strategies that will be put in place. Maybe something like creating a zone a particular zone where only medical marijuana will be grown and then exported, but not for local consumption, because a lot of other places that have made that, the problem is not even about this medical consumption, it's about the recreational.
Okay.
Yes, that's where the problem is. And a lot of people that had made that mistake, a lot of countries, they are reversing. They are turning back. Yeah, in Canada, in the US, a lot of states in the US had made that, had done that, and now they are reversing. And I think of recent again, a number of countries in Europe. And then as we speak, Ghana also did that, and they are contending with, not only that Ghana is contending with the repercussion of that, we are contending with it in Nigeria, because that's where the issue of Ghana Loud, they come, they try to flood Lagos with that. They come on the waterway, but fortunately the agency has been able to get re-energize, create a marine command where we have officers on the waterways working with other maritime stakeholders to ensure that we block, we intercept all of these things, arrest them, assist them. Quite a lot of people, I mean, seizures have been made in that regard.
So there is a great repercussion.
Yeah, that I can tell you. That I can tell you, because that's the most commonly abused. And then beyond that, our peculiar situation today does not give us that liberty to want to toy with that. Like I did say also, that does not foreclose the possibility that in the nearest future there could be this possibility of creating a zone for where like what you have, what's it called, export zone, yeah, like creating a zone where it's only done there for medical, for export, not for local consumption.
Okay.
And it's only one place, not something like you were mentioning when you were talking about where cannabis is being grown in Nigeria. You were mentioning South, and now it's all over the country.
Wow.
Taraba, Adamawa, Kano, Kaduna, South, Cross River, all of those places, Southeast. So it's not something just limited to as people used to know, especially our Ondo and Edo. No, but now it's everywhere.
Okay. I know that rehabilitation of drug abusers is not easy. The way you mentioned it, that you have rehabilitation centers in these places, you are even trying to add more. I know that rehabilitation of drug abusers is painstakingly slow and humongously expensive.
Now you got it. So that's why prevention. Like I often tell people, treatment, that's rehabilitation. It's not a walk in the park. You just walk into a park and then walk out. You may know when you are at the point you are going in, but you can't tell when you ever come out of it. Most people don't. They live with it lifelong. Most, that I can tell you. And then, so that's why and I'll tell you that we place emphasis on a lot of sensitization and providing support to people that are having these issues. And I'll tell you that in the last 56 months, we've had more than 11,912 sensitization programs in schools, worship places, churches, mosques, palaces of traditional rulers, workplaces, markets, and motor parks, everywhere, communities, rural communities, all of these things, we have had that number. And then in our treatment centers, the 30 treatment centers we've had 28,012 persons treated. 28,000. That's huge.
20,000.
That's huge. So, indeed, we're trying as much as possible to see that. But then, even with that number, we still have. That's why we have to create a virtual system where people can still be attended to. And, my brother, averagely, in a place like Abuja today, treatment in a standard rehab will cost you 1 million, 1.5, 2 million per month.
Per month?
Yeah.
How long will rehabilitation last?
Standard 6 months.
Wow.
And there are people that have been in and out 10 times. I don't want to be giving people's examples because they may be, some of them may watch this even without mentioning their names. The moment they watch, they will know is their. So we keep this thing so that people are not
castigated,
traumatized. No, traumatized.
Okay.
Because they are. Because it's not what people go through. You wouldn't want to see your enemies go through it. And unfortunately, because of the fear of being judged or stigma, most people cannot come out to share their experiences. And that's why we commend those that have the courage to come out to share their experiences. If you watch our YouTube channel, that's at Ndlea TV, we have quite a lot of these stories there where people with lived experiences or even those still in recovery come to share you. There are people that have done horrible and terrible things under the influence of drugs. So you wouldn't want to see that. And you see, don't forget that for any individual who is independent or suffering addiction, he's not the only one suffering it. The entire family. Yes. Because, and I've just told you what it costs in an average standard rehab a month. How many families can afford that? That I know of families that have been wrecked because of this. There are some people that have 2-3 kids. There are some families that have 2-3 kids battling with it. How would they? So, meaning that, the chairman of Ndlea, General Mama, had given this example, in a lot of public fora, that in a lot of cases, in a number of times, parents had had to tell him, highly placed people, that they cannot go to bed unless their own kids come back from their outing and go to bed first, and the man is sure that his son
in bed
has locked himself up, gone to bed before he can go to sleep, because he's afraid that if he goes to sleep before the son comes back, he may not wake up in the morning, because you see the man comes with a knife or something to slaughter him. So they are in perpetual, they are traumatized. Apart from the stress, the trauma of the financial burden on the family, taking care of these people, there are some of them, there was one that after he has sold virtually everything, took the father's laptop that cost over 3 million naira. I think he sold it for less than 300,000 naira. Because he needed, when that urge comes, they can sell their parents to buy these drugs. So it's traumatizing. It's not just only depressing to see your loved one go through this. It denies you of the resources to take care of other people in the family, to take care of other needs of the family. But the fact that you are even in perpetual fear, that because you hear stories of people, the chairman of Ndlea had also mentioned in a lot of public fora that a number of times, because I don't even know whether he sleeps, honestly, that's the truth, because we walk around the clock, and then still people will still call him that they are the husband of their daughters.
Wow.
chasing their daughters around the house with knives, with cutlass, with bottles, all those kind of things. So please, can you send people to come and rescue? You know, those kind of things. So which parent will be happy to receive a call from her daughter who is newly married that, Daddy, please help me, my husband is chasing me. I mean, after those guys have consumed, or they've gone out, so they've consumed illicit substances and they are back, their mind is altered already, and then they begin to do the...
Now, the other time I mentioned that people are advocating that politicians seeking public office should be tested.
Yeah. It's an advocacy week.
Now, not only politicians now.
Yeah.
You just told us about a newlywed.
Yeah.
Who are those that Ndlea would rather advise should take drug tests?
It's everybody. Our advocacy cuts across everybody. When we started this advocacy, when I remember very vividly when General Moore started pushing for this in 2021, he indeed started by saying that students, and we are glad that just recently we have a very proactive minister, that's the Honorable Minister of Education, Dr. Maruf Tunji Alausa. Yeah, we went to him. The chairman of Ndlea led some of us in a meeting with the minister, and especially everything we presented here. One of those things we presented is, even though a lot of schools have adopted that policy, drug test, one of the things we do is we realize that there might be, when you generalize it, and already there are quite a lot of this substandard or fake testing kits out there which may not give the results. So the Ndlea we work with technical partners to develop Ndlea testing kits, something that can give you that can discover 15 to 18 substances. So, and we make that available to all our commerce across the country, and it's developed in a way that an individual, I have even given as gifts to my friends, as in your home, you can apply it on your kids, on people with you, just to ensure, especially when you are in doubt that this individual is probably already experimenting or taking drugs. Why that is important is early detection. When you detect early, you are able to provide, because it's easier to attack, to treat at that level before it gets to dependence, which is the addiction. When it gets to that addiction, a lot of things have been altered in the system. It's just like you say you want to treat high blood pressure. You understand what I'm saying?
Yes.
So it's better to not get there yet. Manage it at the level when it's still experimenting or still habitual user, all of those things. But the moment it gets to the point of addiction, it becomes a serious, complicated medical issue.
Okay.
So,
from the work you are doing in Ndlea, why do you think women are hooked on drugs? Now, for instance, this is a complete housewife. She doesn't go anywhere. We have very many of them in some states in the northern part of this country. Full-time housewives, doesn't go to, has limited friends. What can predispose them to taking drugs? And like I said, very many of them these days.
Okay. Before I come to that quickly, let me round up on the advocacy for drug integrity test. That's what we call it in Ndlea. We're pushing for students to do that. University students, secondary school students, everybody to go through this. As a condition for admission, a lot of universities have adopted this, public and private universities, that I can tell you. But now with the Ministry of Education taking it as a policy, and in fact at that meeting, the minister announced the establishment of a drug use prevention unit in the ministry itself. Then we also advocated for prospective couples, to also go through this as part of the requirements for the wedding, because they go through genotype, they do conduct genotype tests, HIV/AIDS tests, I mean, there is no law saying they should do that,
Yes.
but they do that for self-preservation.
Preservation.
So nothing stops them from also conducting, and we are also glad that quite a lot of faith based
organizations.
yeah, and some traditional institutions are already also following this as part of requirement for
Wedding.
to conduct wedding. Apart from that, for people who are looking for jobs, and we're glad again that quite a number of government establishments have also adopted this, and even the private sector, they have also accepted this. Where it's a revolution we are driving, and it's really going around, that I can tell you. But because it's a medical issue, that's why we are not it's not just we're not being loud with it out there, because you can't say, oh, we conducted drug tests for even though when we do it ourselves, the agency, it's standard policy. Before you can be recruited, you have to go through it, and even periodically as officers you are subjected to it. So that's a standard thing, and we're glad that a number of government institutions are also doing this. And apart from employment, even in some organizations, promotion in the military, before you promote or even go for certain courses, is a standard requirement. You have to undergo drug test. So that is going on fine, and we're just trying to see what this does, apart from the early detection, which would help to facilitate early treatment. It also creates some deterrence. When you know that before you gain admission or before you are admitted, you'll be required to bring drug free, and even now for some people, for some countries that require visa clearance certificate, visa clearance certificate from Ndlea, it's also part of the requirement. You have to undergo drug tests. So when you know that you are going to be facing this, that will deter you, restrain you from toying with it, because you know that there might be consequences.
Yes.
So that has some deterrence effect. So that's one of the reasons, that's one of the motivations, that's one of the major benefits. Apart from early detection, which facilitates early treatment, there's also the deterrence effect of it. Okay. So having said that, let's now come to the women.
Yes.
You are asking,
yes,
why women? Well, I'll tell you that indeed this is a challenge that has not left any country or any tribe or any gender. It has not left them any, free. So quite a lot of factors are responsible, depending on, for instance, if you look at a particular section of the country, not even particular section, let's look at generally polygamy.
Yes,
is an issue for women, but predominantly in a particular section of the country, when people are at liberty to marry as many wives as possible, and then these people, they are married, they are left, and then the same man moves on to another, that kind of a thing. These people go into depression. For them to be able to cope, they look forward to, or they resort to abuse of illicit substances. Yeah, and from our interaction, from statistics, that is already established. Then there is also the issue of poverty that's started there. So the environmental factors, again, medical issue, family background, all those kind of things, they are all the same predisposing factors responsible.
Okay. Earlier you told us that before now you had 4,000 staff. Now with additional 10,000, that's 14. But you have equally reeled out so many things that the Ndlea does. Manning the border, rehabilitation, arrest and prosecution, and this and that. Is the number enough? The question
that's why I told you again when somebody called in to ask that I said we have there are plans definitely to beef up, because we have an existing approval for that. We just need to reactivate that process and see get the federal government's not to go ahead with that process. But I'm aware that something like that, to beef up what we have, because our own in a number of countries, our counterparts there only face one leg of the work,
yes,
one wing of the work. But here we combine everything. So meaning that we have need of more manpower. Like I said, predominantly we are on two major pillars. That's drug demand reduction and drug supply reduction. That is, different from some other areas, but these are the two major pillars. Fronts our work depend on, where we work mainly. So we have quite, and don't forget that we have presence in every part of this country, and we're also trying to be in every local government as much as possible, because we need intelligence. We need to work with the local communities, the stakeholders there, to ensure that not only in the area of enforcement, but to ensure sensitization and providing treatment for those, especially those who are starting before it gets to
now. Because of our time now, we are running seriously.
Now you are not remembering because of time. After 1 hour,
we have even gone past 1 hour.
Looking at my watch, the clock on my phone.
We still have
because I have lots of calls coming in from my office already.
What I should have done before we started this program was to seize your phone and put it somewhere. Now, because of our time, like I said, there are agencies of government that will say, we arrested somebody, instead of us to prosecute it. We got a call from a higher quarters, and they said, let him go.
That we don't have.
Your hands are tied.
We are very. I can tell you, because this is a major problem, and I'll tell you that the highest authority in Nigeria is President Bola Tinubu, and he's well seized about this issue. He gives us absolute 100% control, absolute 100% support. That I can tell you. Just today, just shortly before I got in here, I addressed a press conference. I think your station was there.
Yes.
Where we updated.
We have even used the report at one.
Thank you. Where we updated the Nigerian public about the sources of our interventions over the arrest of some 3 Nigerian pilgrims in Saudi Arabia. And like we did say in that statement at the press conference, that the biggest support came from the president himself. Do you understand? So indeed, I have not seen anywhere, and if you look at the caliber of
people involved,
you look at the caliber of even the chairmanship executive of Ndlea, you will know that he's not, it's an accomplished person. So it's not somebody that you expect pressures from here to. No. He's very, for him, following the law. But then he has utmost support from the president, from our legislative arm, that's the National Assembly. Absolute, good support from there, and again from the Honorable Attorney General and Minister of Justice, that's under the Ministry of Justice, where we the agency, it's under the supervision of that ministry. We have absolute all round, and then more importantly, the populace. Now we have quite the level of awareness about the problem of drugs in Nigeria now is very high, as against what used to be some 5-6 years ago. Do you understand? Meaning that the kind of thing we are doing is creating that awareness, and then the people are seeing results, and then you now know that, okay, I got to support this, because if I don't know what will happen tomorrow. You don't have to wait till the trouble knocks on your door.
Okay. In Nigeria today, we value, like you have mentioned earlier, wealth, money, quick money. There is the Yahoo business that people are doing. There is this drug that our youths are going into. Are you getting support? You mentioned that you are getting support from outside your sister organization locally. Are there groups that are working with you to ensure that our children are sensitized
Absolutely.
enough? And in what areas do you have these people?
Absolutely, we have like I said before again, apart from us working with sister security agencies, we work with other ministries, departments and agencies of government. Under we have a body called the Interministerial Committee, which is shared by the Chairmanship Executive of Ndlea. All relevant ministries, departments and agencies work under that. Don't forget that what we're doing, the nation has a policy document for the fight against drug abuse and illicit drug trafficking called the National Drug Control Master Plan. The master plan we're implementing at the moment will expire. It was 2021 to 2025. We're working, that's NDCNP, National Drug Control Master Plan 2021 to 2025. It will expire at the end of this year, and we're already in the process of producing the one for 2026 to 2030. That I can tell you. So all of this, this stipulates the responsibility of all the relevant stakeholders, including those in government. And what our approach is, a whole of society approach. Everybody, a whole of government approach, a whole of society approach. Nobody is left. What we are doing now in the last 1.5 hours, that's a whole lot. That's a bad. I think this is probably the longest interview I will ever. I know I've done 1 hour, but 1.5 hours. This is Captain is giving me the longest.
You see, my last question.
Okay.
Because you have complete now, so it's going to be my last question. But
after the time we are
except you give me another ammunition.
I will give you another ammunition again.
Now you are the only person that has come on my show, and you don't seem to have any challenges at all. Everything has been smooth from all that you have been saying. Don't Ndlea have challenges or areas where assistance are still needed?
You know that's not even. You know that's not even human not to have challenges. the best of societies still have challenges. Definitely, every organization has its own challenges. Like we say, the tax on our hands is huge and enormous. Like I said, we're getting good support from the president, from the National Assembly, from the relevant MDAs, but then because the volume of resources we need, I mean, we can't but ask for more. So that's there, and beyond that, definitely, like we say, this is not about President Tinubu. This is not about General Marwan. This is not about the Ndlea. It's about us as a people, as a nation, as a country. So this problem is something that is a challenge to every one of us, and our response has to be collective. So that driving everybody to take that collective decision and collective action is what is our goal. It's our ultimate goal, so that tomorrow nobody will think, oh, somebody is moving drugs or abusing drugs. What's Ndlea doing? What's the federal government doing? No, what are you yourself doing? Like I did say, we rely on intelligence for all our operations. So how many people will be ready? And we can assure Nigerians that information given to us, we don't even need who you are. I mean, quite a lot of that same toll-free helpline also serves as a
reporting line.
Yeah, reporting line. You give information, it to be passed through the normal process, and our social media handles are also available, what we call DM, and we have emails, info@ndlea.gov.ng. All of those platforms are available for anybody to provide information in our collective interest.
In my magnanimity,
you are ready to answer. It's because the time is actually gone.
Yes. I want to thank you, Mr. Babafemi, for coming on the program and for how you have addressed the issues that we have been able to raise on this program. We wish you very best of luck. We know you're a very busy man.
Thank you.
And our regards to the Chief Executive Officer of the agency,
Thank you.
General Marwa.
And definitely know he will watch this.
Okay.
If not live, he will watch the recorded version of it.
Okay.
That's on your the streaming platform.
Yes. Well, this is where we call it a date on the program this afternoon. Polity, it continues. We'll come your way tomorrow at 2 p.m. with another edition, with another presenter and other guests. My name is Segun Ojelade. Join me in the evening at 8 p.m. for Matters Arising.